When the heart beats, oxygen-poor blood enters the right atrium through the superior and inferior vena cava and the coronary sinus. Blood flows from the right atrium into the right ventricle through the open right AV valve or tricuspid valve. As the right ventricle fills, 70% flow is passive through the relaxed right atrium. When the right atrium contracts, it completes ventricular filling by pushing in the last 30%. Now, when the right ventricle contracts, the tricuspid valve is pushed closed and it prevents backflow of blood into the right atrium. As contraction continues, pressure on blood inside the ventricle rises until the pulmonary semilunar valve is forced open. Blood is propelled into the pulmonary trunk and toward the gas exchange surfaces of the lungs, where oxygen is picked up and carbon dioxide is discharged. The pumping of the right ventricle also forces oxygen-rich blood in the capillaries of the pulmonary circuit toward the left side of the heart within the pulmonary veins. These veins empty into the left atrium. From the left atrium, blood flows into the left ventricle through the open left AV valve, the bicuspid valve. As on the right side of the heart, 70% of the blood flow into the left ventricle occurs while the left atrium is relaxed. Atrial contraction provides the remaining 30%. Then, as the left ventricle contracts, the bicuspid valve swings shut, preventing backflow into the left atrium. As the contraction continues, ventricular pressure rises until the aortic semilunar valve is forced open and blood rushes into the systemic circuit. After traveling to tissue capillaries, blood will return to the right atrium and begin the cycle anew. Because more work is required to push blood through the systemic circuit than through the pulmonary circuit, the muscular wall or myocardium of the left ventricle is thicker than that of the right.